Rutland Regional Medical Center is ready to break ground on a $6 million expansion and redesign of the emergency department. With work slated to start this month, the 18th-month construction period will make Rutland Regional more versatile in caring for patients. PEGTV's Amanda Wheeler has the story.
We are going to be doing a pretty complete renovation of the interior of the emergency department. The exterior will look pretty much the same. There won't be a lot of changes. But we'll take on some additional space from our cafeteria and a couple other adjacent areas. The volume of ED patients has been growing over the years, slowly but growing, and the nature of the patients has changed as well. We certainly have more patients with behavioral health issues, both mental health and substance abuse issues. We need to create a space that's appropriate for them and can serve them better as part of our mission.
The renovation and expansion will add an additional 6 exam rooms, create a discrete area for behavioral health patients, and make the lobby entrance more secure.
We work very hard to take care of our patients as quickly as possible in the ED. So right now that means to get them started in treatment, we're often caring for patients in hallway beds that are literally in the middle of the hallway in the ED. This will alleviate a lot of that and get people into more private spaces more quickly. It's really to adjust for that volume, to serve our patients well, to make sure that they get the care that they need.
On an average day, the ED sees roughly 100 patients. Some days they see as many as 140. The redesign of the emergency room will make the patient experience more seamless.
And it's important for our patients so, A, we can begin treating them more quickly. We can get them into a proper treatment space with privacy, with the right equipment, so that our doctors and nurses can really make sure the care is flowing as rapidly as we can make it go. It's really having enough space to work in, given the volume of patients we have.
This project was originally slated to begin before now, with a different design. The hospital halted their plans to move forward after realizing the plans they had designed may not be the most effective solution.
So this project actually is a little delayed. We had gone to the state for approval for a project that was about $4.8 million. And as we were finishing the design work, we were frankly not certain it was going to really correct the flow problems that we were experiencing. So we looked again. We actually built and worked with a computer simulation process with different volumes of patients at different times of the day with the exact layout that we had in mind, and found we're right. Our hunch was right. It was not adequate. So we went back and did a whole redesign. Went back to the state for an additional approval saying we didn't have it quite right. But that simulation we think is really going to help us out because it made sure we had the exact right kinds of exam rooms in the right locations to meet the needs of our patients. So it was a little bit of slowing down to make sure we got it right.
CEO and President Tom Huebner says the 18-month construction period will require patience, but the end result will be worth it.
It'll be difficult. I've described it sometimes like, building a jet airliner while flying it. It's going to be hard. We'll never have fewer exam rooms open at any time during the construction period. We'll be doing some of the new construction first. But we will have contractors in and around the ED, and I'm sure our patients will notice that. We'll really try to minimize the disruption there, but there'll be that.
While the $6 million project will streamline patient experience, President Huebner notes that the building is not the most important aspect of this community hospital.
In the end, what people care about most is not our building. They care about our staff primarily. Do we have good doctors? Do we have good nurses? Do we have good technicians? Are they not only technically competent, but are they kind and pleasant and provide good service? That's the most important thing, absolutely positively. But people also want to be in space that is modern and efficient and well-equipped for our needs. So we've been getting great feedback on that along the way, but we don't miss for a moment that what's most important is the human touch.